In just 10 minutes, unlock the most powerful insights from Andrew Huberman's 3-hour deep dive with Dr. Roger Seheult. Discover science-backed ways to boost your immune system, fight infections, and improve overall health, all in a way that's easy to apply to your daily life. Stay till the end for game-changing health tips. Here are the key takeaways from the podcast. Takeaway 1. The pillars of a strong immune system. To stay healthy and avoid infections, it helps to follow fundamental lifestyle habits. Dr. Seheult mentions a concept called New Start, which outlines key areas of focus. Nutrition, eating whole, unprocessed foods help support the immune system. Avoiding excess sugar is important as it can weaken immune defenses. Exercise, moderate physical activity reduces inflammation and strengthens immunity. However, excessive exercise can suppress the immune system, as seen in professional athletes who often get sick during intense training. Water. Staying hydrated is essential for proper immune function. External use of water, such as saunas and cold plunges, can also enhance immunity by stimulating certain immune responses. Sunlight. Exposure to sunlight is critical for immune health, beyond just vitamin D production. Infrared light from the sun can penetrate deep into the body and improve mitochondrial function. Rest. Quality sleep strengthens the immune system. People who sleep well respond better to vaccines and get sick less often. Trust. Having a sense of community and reducing stress through faith, relationships, or mindfulness can improve overall health. For example, if you tend to get sick often in winter, improving sleep, increasing sun exposure, and avoiding excess sugar could make a noticeable difference. Now let's move to the next takeaway. Takeaway 2. Sunlight does more than make vitamin D. Most people know that sunlight helps produce vitamin D, but its benefits go far beyond that. Sunlight contains infrared light, which penetrates deep into the body and helps mitochondria function better. Mitochondria are like tiny power plants in our cells, and when they work well, the immune system is stronger. Infrared light helps reduce oxidative stress, which can lead to chronic diseases like diabetes, hypertension, and dementia. Getting outside in the sun, even for 15 to 20 minutes a day, can improve energy levels and overall health. People living in green spaces, where sunlight is reflected more intensely by plants and trees, tend to have lower rates of disease and inflammation. For example, a study in Louisville, Kentucky, found that simply planting thousands of trees in an area led to a 133% drop in inflammation markers among residents. So if you want a simple way to boost your immune system, step outside and let the sun do its job. Now let's move to the next takeaway. Takeaway 3. Red light therapy helps mitochondria work better. Red and infrared light can improve cellular health and energy production. Mitochondria produce energy but also generate free radicals, which can cause cell damage. Red light stimulates melatonin production inside mitochondria, which acts as an antioxidant and protects them. This process reduces inflammation and helps prevent chronic diseases linked to mitochondrial dysfunction. Research shows that exposing the body to red or infrared light can improve vision, lower blood sugar, and enhance metabolism. The best source of red light is the sun, but red light therapy devices can be useful, especially in winter or for those who spend a lot of time indoors. For example, a study in England showed that exposing older adults to just 3 minutes of 670 nanometer red light in the morning improved their vision by 177%. If you feel sluggish and drained, you might just need a little more red light in your life. Now let's move to the next takeaway. Takeaway 4. Sunlight reduces the risk of flu and colds. Sunlight plays a crucial role in protecting against viral infections. Research has shown that influenza cases peak 1 to 3 weeks after the shortest day of the year, suggesting that lack of sunlight is a key factor. A Harvard study found that sunlight strongly protects against the flu. A study in Europe showed that COVID-19 surges during the autumn and winter were perfectly predicted by latitude, meaning the further north a country was, the earlier and more severe its outbreaks. Hospitals used to have sun decks for patients to help speed up recovery. This practice has disappeared, but the science still supports its effectiveness. For example, in 2009, During the H1N1 pandemic, the virus spread in warm and humid places, showing that it wasn't just the cold that caused flu outbreaks, it was the lack of sunlight exposure. Now let's move to the next takeaway. Takeaway 5. Get outside in winter for better health. One of the biggest problems in modern life is that people spend too much time indoors, especially in winter. In the US, 93% of time is spent indoors, which limits exposure to beneficial sunlight. People who work indoors often go weeks without direct sun exposure in winter, which can weaken their immune system. Research shows that all major natural causes of death, including heart disease and Alzheimer's, peak 1 to 3 weeks after the shortest day of the year. Even on cloudy days, enough sunlight comes through to provide health benefits. Simply being outside during the day is much better than staying indoors. For example, if you live in a place like Boston or London, where sunlight is limited in winter, making an effort to go outside during lunch breaks can make a significant difference in energy and immune health. We're halfway through the video. Thank you for sticking with us this far. If you're enjoying it, please give us a thumbs up and share it in your WhatsApp groups. We'd love to hear your thoughts, so feel free to comment below. To see more videos like this, make sure to hit the subscribe button. Now let's continue with the video. Takeaway 6. Avoid too much artificial light at night. Too much blue light at night can weaken the immune system. Screens suppress melatonin, making it harder to fall asleep. Poor sleep increases the risk of infections and chronic diseases. Hospitals with bright artificial lights 24/7 cause ICU psychosis, where patients become mentally disoriented. A dark room and less screen time before bed can improve sleep and immunity. For example, studies show that people who get too much artificial light at night have higher rates of obesity and heart disease. So dim the lights and sleep like your health depends on it, because it does. Now let's move to the next takeaway. Takeaway 7. Green spaces improve immunity and reduce disease. Being around trees and plants has surprising health benefits. Trees reflect infrared light, increasing exposure to beneficial wavelengths. Studies show that living near green spaces lowers rates of hypertension, diabetes, and other illnesses. A study in Kentucky found that simply planting trees reduced inflammation. Forest bathing, a Japanese practice of spending time in nature, boosts the immune system. For example, if you live in a concrete jungle, visiting a park regularly can make a measurable difference in your health. Now let's move to the next takeaway. Takeaway 8. Hospital patients recover faster with sunlight. Sunlight exposure helps people heal faster. In the past, hospitals had sun decks because doctors noticed patients improve faster with sunlight. Modern hospitals have moved away from this despite strong scientific evidence. Patients in hospital rooms with windows recover faster than those in rooms without. Some doctors are now pushing to bring back sunlight therapy for critical care. For example, a 15-year-old leukemia patient was expected to die. His last wish was to go outside. After 5 days in the sun, his fever disappeared and his lung infection cleared up. He survived. Now let's move to the next takeaway. Takeaway 9. Cold plunges and saunas strengthen immunity. Hot and cold therapy can boost the immune system. Cold plunges trigger immune responses and reduce inflammation. Saunas improve cardiovascular health and lower the risk of illness. Alternating hot and cold treatments, used for centuries in traditional medicine, strengthens immunity. For example, Finnish research shows that regular sauna use reduces the risk of respiratory infections and heart disease. So maybe those Vikings were onto something. Now let's move to the last takeaway. Takeaway 10. Sunlight may help with weight loss and metabolism. Lack of sunlight may contribute to obesity and metabolic issues. Sunlight affects blood sugar and energy production in cells. Red light exposure has been shown to lower glucose spikes after meals. Regular sun exposure can help regulate metabolism and prevent weight gain. For example, if people got just 15 minutes of sunlight daily, independent of diet or exercise, obesity rates could drop by 20 to 30%. That's like getting free weight loss just by stepping outside. Here is a brief introduction about Dr. Roger Seheult. Dr. Roger Seheult is a board-certified physician in internal medicine, pulmonary diseases, critical care, and sleep medicine at Loma Linda University. Thank you for watching. I hope you found this summary of the Andrew Huberman podcast with Dr. Roger Seheult informative. If you're interested in learning more about these topics, I encourage you to watch the full podcast on YouTube by clicking on the link in the description below. If you enjoyed watching this video, please leave a like below and share this video in your WhatsApp groups. You can also discuss about this video by commenting below. To get more such videos in your timeline, press the subscribe button below.